you can still do some modification, of course. You have a special point, this 9.1, it's called, where you have the final outcome by the app, but then you have all the instrument to change it to idealize. What is even more important is for each screenshot of the app, you have like a red button, you push there, you can find actually underneath a kind of ebook explaining all the steps of this topic exactly, pushing this kind of button.
It's a library backup.
It's a kind of library, exactly, big library. A lot of alerts if you are out of the road and the right road. They allow you to say, oh, stop it. There is an alert showing the practitioner, don't do it because it's wrong. So it's really a unique stuff. I cannot explain. I couldn't explain so much in the lecture, of course, because there was not time to do that. But really,
and what procedures are the main? What are the main procedures that the app is made for?
Oh, it's the treatment plan. Treatment plan, not in terms of keeping the tooth or position an implant, but just having the chance.
Yeah, I was gonna.
Having the chance to really.
It's gone.
It's gone. Having the chance to position the teeth in the proper position. To, for example, know how much you have to lengthen and shorten the teeth, or to put more buccal, more lingual. How much you have to increase the vertical dimension. What kind of orientation of the closure plane, all the reference line, all together that create a new system. Normally, there is a very big mistake in many countries around the world, at least in my country for sure, but always, everywhere, that the technicians that don't receive the information they invented for us. And they normally don't see the patient, and we see the patient. We are obliged to follow some rules and to give them the right information that normally they don't receive it, they invent. They are not magicians. They are good workers, great artists, but not inventors.
Yeah.
So the position of the teeth should be our responsibility. We have everything to do that. That's it about the app.
Well, quite interesting, And so you're using yourself the app at the same time, no?
Use what?
You yourself use the app.
Use the app.
Yeah. In your practice.
Of course.
Yeah.
Of course. It's absolutely something that you use every day. Of course, you don't use for single crown.
Yeah.
It's not needed. You see from 6 teeth to maybe complex cases, 1 arch, 2 arches. I think that didactically it's just great, especially for the people at school. But I'm saying that because the school are very important to teach and they have to learn. But I'm sure that most of the dentists around the world are not really comfortable with and confident with these topics. So I'm sure that it's very, very well done as is guiding really all the practitioners, every practitioner.
Okay, well, it seems like a quite interesting app, and I think it should be helpful also for, as you're saying, for schools too.
Consider that it's so widespread. It's 80 countries already covered. Maybe in Nigeria, 2 in Costa Rica, Bahrain, all this maybe strange, Vietnam, 3 in Vietnam.
Just spread the...
We are really spread because we did the advertising just speaking and doing the Facebook and on our website. I didn't do any kind of campaign. Because then the next step should be have this 2D, because it's a 2D dimension, not 3 dimension, 2D dimension. That should be as I've shown. We have a face scan, the chance to use a face scanner, digital articulator, digital Facebook. In this case, we should have the chance to have this app, the values the app gives to us, actually all the numbers, all the exact numbers, to be inserted inside a 3D software that can manage everything and can then produce with the CAD/CAM system the final product, the final restoration. That is the main point, and for that we need a joint venture with some companies, because myself I'm not strong enough to support this. I did already a lot of investment to do this app. It's very, very expensive, and so I need some help right now.
All right, well, it's just super interesting. I think I have enough, unless you want to add anything else.
Yeah, great.
That's good. Thank you for your time, Dr. Fradeani.